Good afternoon. My name is Ben Cornwell, and I am professor and chair of sociology at Cornell University. And thank you for giving me the opportunity to present some ongoing work that I'm doing with a recent graduate student of mine, Alyssa Goldman, who's now assistant professor of sociology at Boston College, on the relationship between dementia and social network change and network structure. What I'm going to present today is a brief sketch of some preliminary findings of a paper that we've started looking at the relationship between cognitive health and the social network data from the NSHAP study, which many of you are familiar with. This is inspired in part by the nature of our sample, which is a sample of older adults, and our recognition of the fact that inevitably with an aging sample like this, you run into concerns about cognitive decline and how that might affect reporting. And we get this at presentations and occasionally a reviewer question about cognition among our respondents. And so we decided to follow up on this and look more closely at the possibility that the cognitive health of the respondents in the NCHAP sample may affect some of the reports of network change. So we look at this from a variety of standpoints, and we draw on several literatures for motivation. One is the research on social network change in egocentric networks, which is something we're all familiar with. And one thing that has come out of this work is that some of the reports of network change might not actually be real. That when people say they name somebody at wave 1 and then they name a different person at wave 2 as a confidant, maybe those people were always both equally embedded in the respondent's environment, and this is just sort of a tendency of a reporting churn over time. So this sort of piques our interest and makes us think twice about some of the reports of change that we get. Some other literature goes back to you can find in the 70s and 80s in the early days of network analysis, egocentric network analysis, where there were some doubts about using respondents as informants of network structure to begin with, and the idea that maybe some reports of network structure were inaccurate. It came down, I think most scholars came down on the side of arguing that ultimately we value respondents' interpretations of the world around them because that is what matters. That's sort of the Thomas theorem, what you perceive to be real is real and its consequences. And it's a subjectivist perspective on networks, and so we value survey-based network data because that is what matters to individuals. What they see is what they act on. And this is alive as well in more recent research using egocentric data, which suggests that when people report network data, including reports of network change, they employ cognitive schemas or heuristics to sort of help them fill in the blanks. If they don't really know what's happening in the world around them, they make assumptions. So, for example, they make assumptions about triadic closure, or they make assumptions that people who are related to each other more closely are more likely to interact more frequently. And so they use that information to sort of inform their reports in a survey. So tying all of these things together, we're interested in the possibility that when we are getting reports back from respondents about changes in their networks, and the data that we get back may be a little fuzzy, partly because some respondents have difficulty remembering or perceiving aspects of their networks. And this is a subtle distinction from this tradition of work here. We're not saying that they misperceive and that their misperceptions are problematic. What we're saying is that in some cases people are unable to perceive things or to remember what they perceived previously or recently, and therefore can't report on it. And by extension, if respondents are not able to remember things that they perceive in their environment or unable to report on them, then they are unable to act on those perceptions, even from a subjectivist standpoint. So for those people, while it might look like their networks are not closely connected, or that those networks don't have a relationship to their outcomes, in reality, it's because we don't really have a sense of what their networks are, and more importantly, neither do they, and that can therefore affect their behavior and outcomes. So, what do the data tell us? So to study this, we use data from the National Social Life Health and Aging Project, or the NSHAP study, which includes 3 waves of data, nationally representative, of 3,005 older adults starting in 2005 between the ages of 57 and 85. And we have followed up on these baseline respondents every 5 years, with wave 2 starting 2010, wave 3 2015, and on pause now. We were going to be doing wave 4, but that is likely to happen next year because of the pandemic. In this talk, we'll be looking specifically at baseline respondents and what they're reporting at wave 2, because at wave 2, something important happens. We introduce the Montreal Cognitive Assessment, or the MoCA, which gives us really nice information about cognitive decline and dementia. And at wave 2 is also when we introduce the social network change module, where we ask people to link up what they reported in terms of their network at wave 2 to what they reported at wave 1. It gives us a sense of network change. So there are several things that we'll be looking at. The MoCA, the adapted MoCA module that we use in the NSHAP, gives us a good sense of anyone who has sort of clinically significant dementia with respect to a variety of dimensions that you can see there. And we're also using this to look at difficulty that respondents had in reporting their network data and information about network change, which is the whole point of this presentation. So with respect to network change, the first thing we're interested in here is whether respondents had any difficulty with respect to reporting how much their networks changed, how much turnover there was, who was lost and who was dropped between waves 1 and 2 over that 5-year period of time. So we had respondents at wave 2 provide their wave 2, their network roster of confidants, and we use a basic important matters name generator to list up to 5 names, as well as any additional people, 1 or 2 additional people who are close to them. And once they've provided their network members at wave 2, we show them their wave 1 roster, and we ask them to connect those to each other so that we know whether there were, to what extent the wave 2 roster reflects the wave 1 roster. And in this process, we also, when there's evidence that they dropped people, so for example, in this case, Ava is not named at wave 2, although was named at wave 1, we ask the respondent for each of those people who were dropped, is that person still alive? And this provides some information that we can use moving forward to assess a couple of things. One, did the respondent have any difficulty matching those people up, which is, I think, a really interesting measure of the extent to which somebody was able to remember people that they named in a previous wave, even given information about those people. If the respondent said, I don't remember the Rob that I named at wave 1, that's evidence that there's possibly some kind of reporting difficulty. Related to that, when we ask them, is that person who's no longer in the network at wave 2, is that person still alive? And they say don't know. That is also evidence of lack of information about the social environment. And relatedly, this gets more to network structure. When we ask them to what extent their network members are in contact with each other, how frequently, if at any point in that set of questions they say, I don't know how often A talks to B, or I don't know how often B talks to C, again, that provides evidence of incomplete information about the social environment. So this is a summary of the measures that we use. There's, a non-negligible number of people in the sample who have clinically significant dementia, about 15% at wave 2. So that gives us some variation that we can work with to assess the relationships with the network measures. As you can see, very few people had difficulty completing the network roster matching exercise, which is reassuring, but also makes it less likely that we're going to find anything with respect to that measure. More people, though still a very small minority of people, had trouble reporting on whether any network members who had been lost between waves were still alive. And a similar number of people had difficulty reporting on the extent of relationships between their between a given pair of network members in their roster. First, you can tell that there's very little difference. You can see there's very little difference with respect to people who have dementia and who don't, with respect to having any kind of difficulty with the roster matching exercise. And there was so little bivariate evidence that we just didn't even bother to do the multivariate analysis here. We'll do that, but I think we're going to want to do some kind of a rare events logistic for that. A lot more interesting is this finding here, which suggests that people who had dementia at wave 2 were much more likely, twice as likely at the bivariate level, to report that they didn't know whether somebody that had been dropped from their roster was still, whether that person was still alive. So 6% of people who don't have dementia and who lost somebody said that they didn't know whether that person was still alive or one of those people were still alive. And that number rises to 13% roughly among people who do have dementia. In a multivariate logistic regression context, you can see that this is still significant. And this is controlling for a number of factors that you can see arrayed along here. We still need to do a little bit of work on the models, but these are highly significant findings. It's a very significant finding. And moving down to the last measure of network structure here, did the respondents report any difficulty in terms of their perception of connections among their network members? And you can see that is slightly higher among people who have dementia, significantly less than 0.01 at the bivariate level. Similar magnitude in a multivariate analysis, but not statistically significant. It's only marginally significant in the multivariate analysis. But overall, there's some evidence here, just with the few measures that we've looked at, that the people who have dementia have a more difficult time sort of getting through the network module, and in particular with respect to when they're asked about network change, sort of providing information about whether their previous network members who they're no longer in contact with are still even alive. Which is a significant and interesting finding. So some key takeaways from this presentation for this particular audience. For one, it does appear that network modules present a challenge to people who have dementia. They have a more difficult time answering certain questions about network members' relationships with each other. And providing information about people with whom they are no longer in touch, which I think is really important. Are those people even still alive? However, it is unclear, I think, to some extent, whether the network module really is more difficult for these people than any of the other modules in the NCHAP study. And we haven't looked at that, and it's something we can do. One thing I'll say also is that this doesn't look like it's a huge problem. It's 15% of the sample, which takes out a chunk, but it's not a big chunk, and I think you can still get a pretty good picture of network change when you take those people away. But you still have to think about the sort of selection issues there. And also, this suggests that we have less to say about, we know less about the social networks and the sort of dynamic social environments of people who are cognitively impaired. And that's a problem, because a lot of what we want to study when we look at social networks in especially in social gerontology is the role that they play in people's lives with respect to things like health and other important outcomes. So we know less about that. We're less able to talk about that. But I do want to emphasize this is not an issue of respondents' perceptions. It's not like that old school approach which argued that you need accurate responses. This is about people who are unable to report on their local social environments and therefore essentially are producing missing data. And that missing data problem is something that, empirically speaking, poses a challenge to us. So there's some conclusions, some next steps here. I can talk about those in greater detail during Q&A if you like, and also have some limitations in mind that we'll be dealing with. But that is what we have found so far, and thank you for listening, and thank you for the opportunity.